Hello, everyone, and thanks for joining us again for today's briefing. A couple of things. We're finally starting to see some good progress in our fight against Omicron. Our hospitalization totals continue to bounce around a little bit, but in general, they're trending down, and that's really encouraging. Now, I think we all know that Omicron spreads much more efficiently and effectively than the other COVID variants. And so we want to thank everybody who's taking the steps that we know are going to continue to keep transmission down. So thank you for staying at home when you're not feeling well. Thank you for continuing to wear masks when you're in public places, because we know how easily Omicron spreads, and this is actually one of the more important times that we need to be wearing a mask when we're out in public. And thank you to everyone who's getting vaccinated and boosted. There's really just overwhelming evidence that booster shots are the most effective weapon that we have against Omicron. And we'll talk about that a little bit more here in just a minute. So those are encouraging signs, but we also know that we're not out of the woods yet. And this is really no time to relax. On average, we have about 18 people, unfortunately, passing away from the virus within our hospitals. And with that pace, we're on a considerable slope to have a lot of deaths from this latest COVID surge. And on top of that, our hospitals remain full. Our emergency departments are full, and there's not a whole lot of room in our ICUs either. So although this is improving, many of our staff continue to be out because of COVID, or because they're taking care of a loved one or a child whose school has unfortunately been closed because of COVID. So anything that you can do to prevent more cases of COVID would be really appreciated, not just by all of us in healthcare, but also in our communities. Now, Clay, I know that there's been some good data coming out regarding vaccines, in particular booster shots and Omicron. Could you share that with us?
Sure, that's right, Alex. And before we do today's numbers, we'll spend a few minutes talking about vaccines and boosters. Last week, the CDC released some new data about how impactful vaccines and boosters are during the Omicron era. Now, these are data from December, so a little bit of Delta in the early part of that month, but by the end of the month, we were almost totally seeing Omicron nationally. And those data showed that if you're an unvaccinated adult, you had about a 16 times higher risk of being hospitalized due to COVID. If you were unvaccinated and 65 or older, your risk of being hospitalized was about 50 times someone who'd been fully vaccinated and boosted. That's 50 times higher. We've also seen vaccine effectiveness data. So right now, during the Omicron surge, those who have been vaccinated with boosting have about an 80% effectiveness rate in preventing ED or urgent care visits, and about a 90% effectiveness rate in reducing hospitalization. There's one other study that came out that showed that just getting sick overall was reduced by about 66% with vaccines and boosters. So the data are continuing to be very clear that vaccination, especially with boosting, reduces your chance of getting sick, your need for medical care, your chance of hospitalization, and undoubtedly your chance of dying. So with that, let's look at what the most recent data are showing us. So first, here's the national picture. The overall number of new COVID cases in the US is going down. That's really good news. As we mentioned last week, parts of this map are going to get darker, however, over the next couple of weeks as Omicron moves into some previous areas that were less affected. As you can see, the virus is still having a huge effect. These very dark areas are areas of high virus transmission. And it's peaking in different parts of the country. We believe it's still going to have more impact in rural areas in coming weeks. And so that's something we'll watch. In the next slide, we'll look at the overall case rates in the St. Louis region. And that's also going down, which is a good sign. It's a little more difficult to interpret these case numbers because there's a large number of at-home tests being done, and there are a lot of asymptomatic cases with Omicron. Right now, the estimates are that anywhere between 40 and 80% of cases are asymptomatic. So what we are actually seeing in this curve is probably an underestimate of the true number of cases. But that said, the overall pattern is one of downturn, and that's really exciting. We do, however, see some suburban and rural counties where the numbers are going the other direction as Omicron moves through the region. The most recent daily admissions on the next slide from our system show that we had 134 new patients. This number is also down from previous high and puts the 7-day rolling average at 186, which is 35 patients below our 220 plus average that we have seen in the metropolitan service area or statistical area in a week or two ago. That's telling us how much COVID pressure there is in the hospitals, how many cases are coming in. And to really understand that, we look at the hospital census number. The next slide shows that we're now back under 1,400 patients hospitalized with COVID, which is really a good sign to see. But that's still a huge number compared to what we've dealt with at any other time in the pandemic. The current total is about 1,236 patients in hospital. We also have 193 in ICU, with 122 of those on ventilators. So despite some talk about Omicron being milder, it is causing severe disease in a large number of people. Of course, the question is where we're going. Here, in the next slide, we'll look at the updated projections for the hospitalized patients. Remember that hospitalizations lag behind case data a bit. So while the case rates in the region have clearly turned down, we're just starting to see this tipping point in the hospitalization data. But here you can see for the first time our models are actually projecting a decline. These are the new lines that slope down and to the right. That's a welcome sight. But also, if you look at the time scale across the bottom, you'll see that it's going to be many weeks before we get down to levels of virus activity that we had before this surge. With such a large number of people in our hospitals and continued large number of COVID admissions and other medical problems, it's going to take us a while to decompress the healthcare system to pre-pandemic levels, most likely March or later. And that means we're going to be under tremendous strain as we both take care of COVID and we try to deal with the other healthcare issues in the community. But nevertheless, it's a good sign that we've turned the corner. It isn't over, but we think the worst may be behind us, despite the fact that we still have record numbers of people in the hospital. In terms of mortality, as Alex mentioned, that's continuing to go up. Death is a lagging indicator because people who die from COVID, unfortunately, often linger in intensive care units and on ventilators. We reported that 24 people lost their lives yesterday, which brings the total for this surge up to 748 since mid-November. It's really a pretty staggering number of deaths for our region. And we're continuing to see high numbers of deaths, even though we talk about this variant as being not as deadly as previous ones. It's simply a law of large numbers. If you get so many people infected, there are plenty of vulnerable people in that population who are going to get terribly ill and die. The next slide shows the reproductive factor, which we've talked about a number of times. When that number is above 1, the epidemic is expanding. When it's below 1, it's contracting. And the most recent calculation was 0.91, which is a good number. That's another hopeful sign that we're going in the right direction. This next exhibit shows what's happening with pediatric patients. We right now have about 40 patients, 22 patients under the age of 11 and 19 in the 12 to 18 group that are in the hospital. And we can also see from these that some of these patients are in the ICU. So it's still having a relatively large effect on our pediatric population. So the final slide concerns vaccination data. And we're continuing to see among the hospitals where we're reporting that about a 40% breakthrough rate. And if you do the math, that still indicates a fairly high level of protection. A common question is how many of those individuals are boosted? And right now, we don't have complete data, but from one large sample, about 15% of people who are in hospital right now have had booster doses. Just a reminder that most of those breakthrough cases, especially those with people who have booster doses but still wind up in the hospital, happen in people who are older who have diseases that compromise their immune system or their ability to fight off the virus. So we're still very much in sync with the recent data from the CDC suggesting that vaccines and boosters in particular are highly protective against severe disease. So Alex, that's what the numbers show.
Great. Thanks, Clay. And I agree. We continue to see a lot of positive signs, but as you know, we're still in a very tenable time right now. And some of the reasons why we're seeing those encouraging numbers is because people did take precautions, including wearing masks and not gathering in large groups. But it's certainly not time to let up on those things that work. We're still in a very vulnerable time for our healthcare systems and for the people in the region, especially people that aren't vaccinated. So because we're still in this vulnerable time, it's really a welcome sign of relief that federal help is going to be arriving this week to support our region and in specifically one of our hospitals. A team of 44 healthcare professionals, including doctors and nurses and therapists, are going to begin arriving at Christian Hospital this week on January 26th. And while we asked for help for many of our hospitals throughout the region, Christian Hospital was a priority because of the region that it serves and because of the amount of stress that it was under. And it's going to make a difference, I think, for the entire region. And so that's a really encouraging sign. Another couple closing comments before we leave. Now, we know we've asked a lot from everybody in the community during the pandemic. So in addition to helping the community with preventive measures and getting vaccinated, we're also asking to help the community by donating blood. So many of you have probably heard or seen those stories about the really significant blood supply shortage within our area, which impacts a lot of things, whether that's being able to do surgery or take care of trauma patients, all of those things. So we know we've asked a lot of everybody in the community, but if you can, please donate. And you'll find numerous places to donate. It's entirely safe and easy to do. We're going to provide some locations and ways that you can sign up here on this slide. Now, lastly, we just want to talk a little bit about how we recognize how hard this pandemic has been on everyone, regardless of if you've been sick with COVID or not. This has been a huge disruption and a stressor for everybody since really the beginning of the pandemic. So our last ask is just to remind everyone that we're a community, and as part of that, we should all treat each other with some kindness and respect, regardless of if we have differences in our opinions or thoughts. Now, we've heard from some of our healthcare workers that there have been some increasing irate and at times abusive incidents during this latest surge. Stress on our healthcare system has been beyond anything we've ever seen, and our workforce really is depleted and exhausted. So please give them the respect and kindness that they really deserve. They'll do everything that they can to take care of your loved one. That's what they signed up to do, but they didn't sign up to be abused while trying to do that. And so please show them a little bit of kindness, a little bit of grace, and some respect. And with that, thank you all for watching, and we will see you again in a week.